Hello, and welcome to this Nursing World Shared Practice Forum. I'm Dr. Laura Wood. I'm the Executive Vice President of Patient Care Operations and System Chief Nursing Officer at Boston Children's Hospital. I'm really pleased to have as our guest today Dr. Ernest J. Grant. Dr. Grant is the immediate past president of the American Nurses Association, the nation's largest nurses organization representing the interests of the nation's 4.3 million registered nurses. He's also the first man to be elected to the office of president of the American Nursing Association in its 128 years of existence. A distinguished leader, Dr. Grant has more than 30 years of nursing experience and is truly an internationally recognized burn care and fire safety expert. For the past 4 years in a row, Dr. Grant has been recognized by Modern Healthcare magazine as one of 50 influential clinical executives in healthcare and as one of 100 most influential people in healthcare. In 2002, President George W. Bush presented Dr. Grant with a Nurse of the Year award for his work treating burn victims from the World Trade Center site. He was inducted as a fellow in the American Academy of Nursing in 2011. Dr. Grant holds a BSN degree from North Carolina Central University and both MSN and PhD degrees from the University of North Carolina at Greensboro. Dr. Grant, welcome.
Thank you. Delighted to be here.
Dr. Grant, can you share with us how the work of the National Commission to Address Racism in Nursing got started and really why?
Well, the commission got started as a result of the death of George Floyd. And also part of COVID that was happening as well. One of the things that we began to notice with COVID was that there was a lot of inequities in healthcare and a lot of inequities that was showing up within the nursing workforce itself. We did a series of Pulse of the Nation's Nurses surveys, and some of those surveys showed that Black and Latino nurses were more likely than their white colleagues to be at the bedside, caring for someone who was actively shedding the virus. They also were more likely to have become infected with the virus as a result of that. As they also answered different portions of the surveys, we also saw just as I said, the continued inequities in the care that that was being done. So that caused us to have pause and to think about what is going on in the profession. We also started hearing other nurses talking about the inequities that they had experienced over their nursing career. And as a result of that, we started the Commission to Address Racism in Nursing.
Would you discuss the origins of the nursing definition on racism?
Certainly. So the definition that is used is the assault on the human spirit in the forms of actions, biases, prejudices, and ideology of superiority based on race that persistently cause moral suffering and physical harm of individuals and perpetuates systemic injustice and inequalities. The commission itself, after much discussion, and let me add that the commission is composed of 4 major nursing organizations. There's the American Nurses Association, the National Black Nurses Association, the National Association of Hispanic Nurses, and the National Co-Mission of Ethnic and Minority Nurses Association. So each of us share a co-lead position. There are 36 other nursing organizations that make up part of the commission as well. And so this definition came out of a lot of hard work that was done, not only from the 4 co-leads, but also we have a resident and scholar whose name is Dr. Rumeh Alexander, who guided this work. And you can imagine what it's like to have 40 plus organizations in the room to try to reach consensus. But we were really amazed with how quickly that we were able to reach this consensus with this definition. And we call it a nursing definition because it does include both mind, body, and spirit, if you will. And if you really stop and think about it, when you think that it involves the moral issue as well as the mental component, it fits right up there with nursing and who we are and what we do. So I've been very, very pleased to see that this definition has been adopted by other organizations as well as we have pursued this work. And so we'll continue to obviously look for, are we still current, with this definition, or do we need to tweak it a little bit as the work of the commission continues?
I think that focus on the holistic approach to the whole person and to the system is a characteristic of nursing. Can you share with us the purpose and the goals and really why the ANA racial reckoning statement matters to the profession of nursing in order to move the discipline forward?
That's a really great question. I think the purpose is, as I said, it came out as a result of the surveys that we were seeing. So the purpose was to address the issue of racism within the profession and actually alleviate it, and to serve as a model for other members of healthcare professions and as society as at large, to bring this to the forefront, have the difficult discussions that need to be had, and address this issue. ANA itself, in order to recognize or to, we realized that we were going to have to put forth some recommendations, but we realized that in order to do that and to be taken seriously, we had to address our own, racist behavior that had occurred, between the years of 1916 and 1964. Nurses of color could not even be members of the American Nurses Association, let alone hold office. And so you can imagine what it would be like to put forth recommendations to say, oh, this is the recipe for addressing racism within nursing, when we hadn't even addressed it ourselves. So as a result of that, the American Nurses Association also came up with a reckoning statement in which it did apologize for acts of omission or commission that limited the growth and the professional development of nurses of color over the years, and recognizing that this is a journey that we're going to have to go on with all the different ethnic and minority nursing organizations across the country, and to realize that this journey is going to be different for each organization. In other words, the journey we're going on with the National Black Nurses Association is going to be different than the journey we go on with the Hispanic nurses or the Native American Pacific Islander nurses. The ultimate goal being the same, but obviously each one of these organizations have experienced racism in different forms, in different formats, and so that's why the journey is going to be a little bit different. As we continue to move forward, it is something that we are working on together. As I told the National Black Nurses Association when the apology was issued, the comment was made, oh, we'll accept your apology, but we're going to wait and see how your actions are. And I mentioned that it's not just ANA's actions alone. You can't expect ANA to do something and then sit back and wait for your approval. This is a journey that we have to go on together. And by doing so, we both organizations, ANA and the specific organizations, are invested in helping to alleviate the racism practice that we are seeing and begin to address. And as a result of that, we'll be able to have a much more successful journey, if you will, as opposed to just ANA going it alone and sitting back and waiting for approval from the different nursing organizations.
Yeah, I mean, the attention of tying so many different groups together and then really saying it needs to be a shared process, really important points of distinction, I think, in the approach that ANA took and that you helped to lead through. In 2022, a national survey was conducted on racism in nursing. Could you share some of the findings from that survey?
Yes, that survey is part of a series of Pulse of the Nation's nurses surveys that we did as a result of COVID. The first one of those surveys showed that, first of all, nurses were suffering from a lot of mental and physical fatigue. And that has still continued as we have done those subsequent surveys, even to this very day. Part of that survey also showed, the initial survey showed that Black nurses and Latino nurses were affected differently than their white colleagues. For instance, nurses of color were probably more likely to have a more financial impact than their white colleagues, so much so that they either had to resort to borrowing money or letting some bills lapse or foregoing payment or repayment of student loans that they may have had. And again, it was also reported that those nurses of color were more likely to be at the bedside providing care for someone who had sustained a COVID infection than their white colleagues. It also pointed out, too, that, again, the inequities in care that was being done. So that all of that together is what helped to drive the formation of the commission, the goals of the commission to help alleviate the inequities and the racism that we were seeing, and also to, create some standards and address, how are we going to resolve the racism issue? And we're addressing it on 4 particular fronts. First one is nursing education. Like a newborn baby who is born, you're not born prejudiced or born with racism. So the same thing with nursing students. When they enter nursing school, it's what is either taught to them or what they may read in textbooks or what they may experience either in the clinical setting that maybe have them developing, such thoughts or such feelings. And maybe they know it's wrong, but in the role of a student, in the role of a new nurse, perhaps they're afraid to speak up. And the next thing you know, it becomes inculcated into their culture, so to speak. The second form is in the area of clinical practice. And again, just realizing the differences in care that may happen with someone or different individuals. And again, not feeling at ease to speak up and question this is some of the things that may perpetuate that. The third area is nursing research. We know that nurses of color are not awarded research grants at the same level that their white colleagues are. And as a result of that, nurses of color, people of color, different ethnicities are not necessarily included in the various results, if you will, of how a research intervention, we understand how it may affect people from the Caucasian race, but does that apply to the different ethnicities across the board as well? So that is a very valuable and much needed bit of research and information that is needed. So we strongly encourage more nurses of color to apply for a research grant and to do research grants. And then finally, the fourth one is policy, looking at what are policies, what are guidelines, what are various things out there that may block the advancement of nurses of color as they want to either ascend the career ladder or the leadership ladder. What are some of the things that are stumbling blocks, and how do we address those so that the playing field is made level for everyone, so that you are considered for advancement in certain positions that perhaps you may not have been considered for in previous settings.
I think several of the points you made really stand out for me, but thinking about what happened during COVID, those nurses were were exposed to more vulnerabilities, if you will, more likely to be in direct care roles, and probably in some cases, at least perhaps many cases, had fewer resources to start with to really fall back on financially and other kinds of supports. Again, feeding on a pattern of perhaps more risk, more vulnerability, and just understanding that.
Yeah, and that brings home the importance of leveling the playing field. Are they, paid, do they get the same pay as their white colleagues who may have the same degree, may have the same years of experience, but or maybe looking at their lived experiences as well is some of the things to take into consideration when we're looking at this from an equity perspective.
That's right. So I wanted to ask a little bit further about how systemic racism specifically influences the experience of racism. Can you share a little bit more about your perspective on that?
Certainly. So a lot of times what we may hear from from our white colleagues is, okay, that was in the past. That's not me. Why am I being forced, if you will, to acknowledge something that happened in the past? And my response to that is, as the old saying go, if you don't know your history, it's bound to repeat. And yes, this is work that all of us have to do, but it's important that we acknowledge that this happened, and to ensure that it doesn't happen again, everyone needs to have a complete understanding of that. And how do we move forward? Well, we move forward by working together, setting down, having those critical conversations. And sometimes it may mean that, having a white nurse to understand the privilege that they may have over a person of color. And I'll give you an example. If I were to walk into a jewelry store, and even though I'm sitting here, the audience may not realize that I'm 6'6". They know that I'm an African-American male, but if I was to walk into a jewelry store, chances are I'm going to be followed around in that jewelry store, and maybe every 15 or 20 seconds be asked, may I help you? Or is there something that you're looking for? A white colleague, 6'6", maybe just as imposing, can come into that jewelry store, and he or she may be greeted, hello, may I help you? But that's it. They're going to be allowed to roam around that store, to look at various things through the glass case, and nothing is thought of them. They're not going to be followed around like I would be. That's what we mean when we say that you are privileged, and that you don't have to stop and think twice about, okay, if I go in this store, am I going to be followed? Am I going to be questioned? Or is someone going to, instantly think that, oh, well, the only reason you're coming in here is to shoplift? No matter, I could be dressed like I am today, or I could be dressed in, just blue jeans and a t-shirt. It doesn't matter how I may present myself in my dress, but I'm still going to be followed just because of the fact that I'm a 6'6" African-American male. And, maybe the experience of that store is that, they may have been robbed before or something like that, but they shouldn't lump me in the same category as they automatically do for other men of color, or because of the way you may be dressed. It could be not necessarily a Black individual. It could be someone from, maybe Asian background, or someone from another foreign country, who, because of their culture and the clothing that they wear, there's that automatic suspicion that
carrying that additional weight.
Absolutely. Yeah. And so to get people to realize that I'm having to carry that additional weight gives you the privilege, because no one is going to think twice that you are a Caucasian individual and you walked into this store or this room or whatever, and there's not going to be any suspicion associated with you, even the way you may carry yourself, the way you may present yourself, as opposed to a person of color.
You express that in a way that's very clear, but I think there's a lot that many of us take for granted, and helping us to realize that this is a weight that many carry in society, and particularly those of color.
Yeah, absolutely. Yeah. And the whole idea about having those crucial conversations it's not to be in an accusatory manner, but it's a way to get you to open your eyes, so to speak, and to realize that. And again, what can we do together to work on solving this issue? Once we've had that conversation, how do we move forward to ensure that this doesn't continue to happen? How do we become an ally for one another, not just for because I will say that there's prejudice on both sides. You could say that but we need to be able to have those honest conversations and honest and difficult conversations, and say, how can we check one another and do so in a positive manner, that we can ensure that the playing field is level and that everyone is addressed, by the way they would like to be addressed or perceived, and not just automatically applying stereotypes.
That's right. I think I know you well enough to know that your relationship-based focus in leadership is one of the differentiators, that it's really about doing work together with others and striving towards the next frontier together with others.
To realize that it takes a lot of patience to do that. This is not a problem that's going to be solved overnight.
That's right. The commission put forward a list of top 10 ways to be an anti-racist in nursing. Could you identify maybe one or two that would be important to prioritize and really focus on?
Certainly. And let me say that the commission came up with these 10 ways to be an anti-racist or to be ally or supporter of the initiative. Because, again, we wanted to, as we have those difficult conversations, and people begin to realize that, yes, this is a problem, and they may want to say, well, how can I help? Can I, as a single individual, what difference can I make? And you certainly can. So there, like I said, there's a number of 10 things that are there. One of the first ones is, of course, to be able to actually listen to individuals and hear their stories and not be afraid to ask clarification questions. Like, what I hear you saying is this correct? Or, so that the individual know that A, I'm being heard, and B, I'm being understood. Or if I get the impression that you're not understanding me, then perhaps I can, break it down into a more clear language or opportunity for you to understand where I may be coming from when I make a statement or make a comment. So it's important that we actively listen to what it is that the individual is saying. I think one of the other more important ones as well is to give yourself permission to be able to reach out and ask the individual for clarification on various topics and et cetera. And then also to give yourself permission to act as an ally when you see that something wrong is being said or is being done. Call it into question. Chances are other people that are around you are thinking the same thing. Mm-hmm. They're just waiting on someone to be brave enough to speak first. So there's no harm in saying, why are we treating this person differently than someone else? Why when a certain person may come into the emergency room late at night, and we're criticizing them for using the emergency room for their primary care, when we may not understand that individual may have to work, 8 or 10 or 12 hours.
Or two jobs
in order to put the food on their table and to mm-hmm. pay their bills, mm-hmm. as opposed to, maybe we should look at, maybe the clinic should stay open from 8 in the morning till 9, 10, 11 o'clock at night. For those individuals, and that way they won't use the emergency room as their primary provider. But we can understand that we need to be able to meet those needs. Talking about access to care, and maybe that person feels that the only way they do have access to care is, unfortunately, is going to cost them probably 20 times the amount that it would to be able to come into the clinic. But maybe if we try to sit down and talk to them and say, are you aware, first of all, that there's a clinic that can meet your needs? Are you aware that there's other services or things that you may be able to avail yourself of instead of coming into the emergency room? So all it takes is just sitting down and having that conversation with that individual.
I was thinking about the framework of listening to understand rather than mm-hmm. to reply. And I think your point of emphasis is on really deep listening and paying attention to understand and to really try to translate that person's intent. Mm-hmm. Thinking a little bit further, and the commission emphasizes the importance of allyship. What can leaders do? And can you give us some examples of effective allyship? What really are the differentiators of effective allyship practices?
Sure, absolutely. Again, recognizing that going back to what I stated earlier, we're all in this together. Mm-hmm. It's important that we work on this together as a team. So I think one of the most important thing is, as I sort of stated earlier, don't be afraid to ask clarification questions, so that you get an understanding of where that individual may be coming from. And that way it gives you the opportunity to advocate on their behalf, and to, when you see something being done or something said that is wrong, then be able to challenge, where did you get that information from? That is not true. Or, maybe ask those challenging questions and see. But it's so important to be an ally, because that's what's going to drive change, and that's what we all want to do, is to be that change agent, if you will, so that we can stamp down the the amount of racism and prejudices and inequities and difficult access to care. We can begin to address those so that they become a thing of the past. So I think leaders can set the example, especially people who are in major leadership positions. If you're the chief executive officer, the chief nursing officer, or whatever, of different organizations and cultures, it starts with you. You're the one who sets the culture. And when people see that the culture of the organization is, we're not going to be tolerant of racist acts or comments or things that may be done, that serves as a reinforcement. So leaders have that opportunity to help set the culture of the organization, if you will, especially when it comes to dealing with allyship.
Mm-hmm. An important opportunity that we don't want to miss out on.
Absolutely. And that they also need to be open to hearing what those underneath them have to say. If I find that there's a policy within an organization that appears to be one that is does not allow for advancement of people of color or whatever, bringing that to the attention of management shouldn't result in retaliation. If anything, it should be embraced. Of thank you for bringing this forward, and let's see what we can do to alleviate this stumbling block, so that everyone, again, we're still just leveling the playing field, but being able to know, for the employee to know that you are approachable, that this is an issue that we're not just checking the box, but we are very committed to diversity, equity, and inclusion. And so if that employee is likely to have a positive experience, guess what? They're going to tell their other fellow employees, and people are going to realize that, yes, this is an opportunity for change, that my ideas, my comments are welcomed, they are acted upon, and that there's communication going both ways, which is extremely important as well, so that change is taking place. And we shouldn't just rest on our laurels when we do that change. We always should constantly be monitoring to make sure that, is it still appropriate, or is there something else happening that as a result of that change now that we still need to address, and how do we continue to move forward?
Yeah, we focus a lot in healthcare about escalating concerns and speaking up for safety, high reliability principles. We use them here at Boston Children's, but that it's a whole nother level of risk, I think, for people sometimes to really speak about their direct experiences and the ways in which they're not able to really participate fully without fear. And that's really what we want to address.
And they need to feel that they are a valued member of the team. We say that there's no I in team, and that's crucial, but they need to see and feel the example that, what I have to say is just as important as one of my other colleagues or someone who may be in a managerial position, and that it is accepted, and I get feedback on it, and or at least clarification. Sometimes I may not be in a position to understand this is why things are because of something that I haven't thought about, but that other people may have thought about, that can clarify that this is why a position may be because of consequences that I hadn't thought about. But once I hear about it, yes, it makes sense now. And, we can spread that to other individuals who may be thinking the same way that I was speaking previously.
Really demonstrating that all voices matter.
Yes, absolutely.
That's right, yeah. So this is such a privilege to have this conversation with you. And as we draw this to a close, do you have any final thoughts or recommendations for our audience related to next steps in addressing racism in nursing? Maybe important steps an individual nurse could take in order to really have the most impact.
That's a really great question, and thank you for the opportunity to provide some final thoughts. I would say that, again, this is something that we need to work on together. This is not a black-white issue. It is a issue that is affecting the human race, and that we need to have those difficult conversations and do so in a manner that is welcoming, that is open, and that will result in change. We need to, what's the old saying? Be the change that that you want to see. We really do need to buy into that philosophy and have the ability, the strength, and the courage to have those difficult conversations, to go through that. And what's on the other side is a better environment, a better world, a better profession. I think as nurses, we need to set the pace for leadership for change and continue to be the leaders of change. And part of that is what we do best, which is setting down, being advocates, not only for ourselves, for the profession, but for the public and those that we care for.
I love the phrase, "The world needs nurses."
Yes.
And it does. And I think about what you have brought forward for all of us, particularly during this time of COVID, your support and encouragement of nurses to persist through really the most challenging times of a generation. And I really thank you for your reflections today. It will be an important conversation that I think we can look back on and draw lessons from. And really appreciate your time today, Dr. Grant.
Thank you so very much for having me. I've enjoyed my visit.
Thank you.